So someone wanted to know about how we classify the various nerves and what their functions are. And so you should know that there are three headers that we have to be thinking of: general versus special. And there are different reasons why a nerve might be special. Somatic, which is the body, versus the viscera, which is hollow organs inside of you. And afferent, which means the sensory, because it's going to, this is to, and this is carry, like ferry, like ride the ferry, versus efferent, which is the motor, which is coming away. So away and to on the ferry to the central nervous system. So nerves can be classified using one of each of these pairs, and then you'll have three words. So, for example, you might have a general, somatic, afferent. And a general somatic afferent is just a nerve fiber that's just carrying the regular, nothing special about it, body, somatic, sensory fiber. So, for example, in the cranial nerve 7, it has a general somatic afferent for just this part of your ear. So parts of your ear are just regular old general somatic afferent. You could have the general visceral afferent. So it's general again, nothing special about it, but instead of it being your body, it's visceral, which is hollow organs, and it's sensory, that's afferent. So you might be asking yourself, why would your viscera need to have an afferent? What would you need to know about organs inside your body? And the reason you need to know what your hollow organs are doing is so you know when to go to the bathroom, or when to, you're hungry, or if you ate enough. These are your general visceral afferents. There are also general visceral afferents that control automatic functions. So the carotid body has to tell your sympathetics to fire if your blood pressure is dropping, or if you stand up, you want to raise the blood pressure. You don't have to think about that. That's all automatic, and because it's a visceral afferent. And the reason it's important to know the difference between the general somatic afferent and the general visceral afferent is because sometimes there's crosstalk between these two. And so you might feel the general visceral afferent pain in the somatic distribution. So the most prominent is when you have a heart attack. That's the general visceral afferent. He's feeling the pain of the heart, but you feel it down your arm. Then that's the general somatic afferent. And so that is a referred pain. Referred. And for neuro-ophthalmology, the referred pain syndrome from the general visceral afferent to the general somatic afferent that you need to know is when you have a carotid dissection. So if you have a carotid dissection, even though the dissection is in your neck, you might feel it in your eye. So they feel it in their head or their eye. That's the somatic afferent, but the visceral afferent is actually one feeling it. So that's the general and the afferent, somatic, and visceral. And then we have special. So we have a special visceral afferent, and special would be like seeing or hearing, the special senses. Afferent is a sense, so you have special senses. And so for cranial nerve 7, that's taste to the anterior 2/3 of your tongue. So that's a special sense. It's visceral, it's inside your mouth, and it's afferent, it's a sensory. So the anterior 2/3 of the tongue is a special visceral afferent carried on cranial nerve 7. And then you've got the efferent, general visceral efferent, and special visceral efferent. These are also carried on cranial nerve 7. And the general visceral efferent is also autonomic nervous system. It's general, nothing special about it. It's viscera, those are the glands, and the two glands are lacrimal gland for tearing, and submandibular and sublingual glands for making saliva in preparation for eating. So these are efferent because it's motor, it's visceral because it's glands, and it's general, nothing special about that. So the lacrimal is carried on lacrimal nerve, which is a branch from the vidian and from the greater superficial petrosal nerve, and the 7th nerve nucleus for the general visceral efferent. The special is the one that's hard. The reason it's hard is the special efferent is difficult to understand. The special afferent taste, that's easy to understand. Taste is a special sense. But the special efferent is only special motor because it's a derived from branchial arches. So this used to be like pharyngeal gill slits, and those moved over time to become the facial expression muscles and the stapedius, as well as the stylohyoid and the posterior body of the digastric. So these are special, not because the motor function is special, they're special because they're derived embryologically from the branchial arches. And they're viscera, even though they're on the outside, except stapedius, who stayed on the inside, because those used to be on the inside, and now they're on the outside. So cranial nerve 7 is a very strange nerve because it carries all of these different branches, and it's really important to know that we classify the nerves general versus special, somatic versus visceral, and afferent versus efferent. Once you have the classification down, then you can figure out what are we dealing with in terms of nerve damage, and they're each carried on different branches, and that's why cranial nerve 7 is tough to learn, and you should watch the other video on cranial nerve 7 if you want to know more.